Hi, good evening. So, welcome to Monday Reading Live. My name is Vandana PS, one of the reading trainers from Neethu's Academy. So, yes, after a weekend, once again we are here to discuss another Reading Live segment. And today I think we are just diving into the strategies of OET Reading Part A and Part B, as well as you guys your concern, how to score a better score. So better score in the sense all of you need above 400, right? Yes, we are just focusing on that. So let's focus today how we can score much better and what are the strategies in Part A and Part B. So before that, I'll just give you a sample question, an exam model question from Part B. So you guys please do the material, this sample question from Part B, so that I'll give you 2 minutes for the same. Then we will discuss the answers. So here comes the question. Hi, so welcome back. Have you all done this material? I think already you have done this material because already we have uploaded the material. As usual, I'll read the material, then we will discuss the answers. Alright. So yes, what is the question? What is the key feature of Remy core that makes it beneficial for patients? It's a very simple, very short pattern of question. And in part B, as we already expected or as you know, it will be of 3 different categories of questions in part B. It can be asked. And here, can you tell me in the comment box what category of question is this? This category comment cheyamo. If you know already, if you understood, please do comment here which category of question is this. This category of question aanu. What is the key feature of Remy core that makes it beneficial for patients? Hi Beulah, good evening. Yeah, so what category of question? No idea. Definitely you know. So what type of question or what category of question? Not a type of question, because type of question, this is a multiple choice questions with 3 answer options and a respected paragraph will be there. But my question, which category of question is this? Can you tell me which category of question? Hi Panu, good evening. So which category below? Any idea? So this particular question is asking what is the key feature of Remicor. So what is Remicor, which means is it a procedure or is it a medicine or an instrument, equipment? What is it? Hi, good evening, Anu. Yes, Anu. Any guess, Anu? What is the category of question is this? This is the category of question. Okay, let's decide. What is the key feature of Remicor that makes it beneficial for patients? So my keywords, feature, Remicor, then beneficial. Alright. Excellent, Swati. It is from category 2, which is a manual. This is a manual. Second category. And in second category, you guys already told me this is a manual. So what is a manual? In the manual, so manual, which means a small booklet. Alright, a small booklet. It will not be a very large book, but a small booklet which contains all the information about a particular device, instrument, machine, equipment or a medicine. So here this is all about a particular anticoagulant. So Remicor. What is the medication guide or medication feature about, or the key feature of this particular medicine, Remicor? That is the question. So question is very simple, right? Yes. Hi Manju. Yes, good evening Manju. Yes, Ashwati, good evening. So now let's decide. So already we read the question. We underlined the keywords from the question. We decided which category. This is category 2 and this is a manual. And what are you reading for in the manual? We are reading for the main idea. Which lines are important? All lines are important, but especially we know that is the first 3 sentences are important, or if it is paragraph, the first paragraph is important. Alright. So after that, let's read the options. Option A, it minimizes the risk of complications through targeted clot prevention. So my keywords, minimizes, then complications, then prevention. Then option B. So what is option B? It provides effective treatment with reduced monitoring requirements. So effective, reduced requirements. And option C, it ensures better kidney health. Yeah, it ensures better kidney health through regular function monitoring. So my keywords, ensures health monitoring. So these are my keywords from the options. Yes. Hi Arya, good evening Arya. We are reading for the main idea. Very good dear. Yes, yes. Okay. So here already we read the options as well. So now let's read the paragraph. Ini namukku paragraph analyze cheyam. Alle. So what is in the para? Extract, medication guide, Remicor. Remicor, which means it is a type of anticoagulant, oral anticoagulant. And I'm going to read the paragraph. Then we will decide which option. So what method we are applying here in part B? So this is the only method we can apply. Plus, likewise we did in part A, we can apply what method? Skimming and scanning as well as in part B. Okay, that's what we can apply. So skimming and scanning, you guys know it is speed reading and underlining the keywords from the text. So likewise here we can just quick read everything, underline some important keywords. Then let's do this elimination method to find out the right answer. I hope it is clear. Hi Lizina. Good evening dear. Yes. Remicor is an oral anticoagulant primarily prescribed to reduce the risk of serious complications arising from blood clots, including stroke and pulmonary embolism. So what is pulmonary embolism, which means fluid buildup in the lungs, right? Yeah. Then, by targeting clotting factors, it effectively prevents the formation of clots in patients with conditions such as deep vein thrombosis, that is DVT, and atrial fibrillation. A distinguishing feature of Remicor is its simplified dosing regimen, which reduces the need for frequent monitoring commonly required with traditional anticoagulants. This makes it preferred option for patients needing long-term anticoagulation therapy. Then, what is the second para? Patients must avoid grapefruit and its derivatives as these can alter drugs' efficacy, while fewer blood tests are needed compared to older anticoagulants. Then periodic kidney function monitoring remains important, especially for patients with underlying conditions. Any signs of excessive bleeding, such as dark stools or prolonged bruising, should prompt immediate consultation with the healthcare provider. So that's all about the 2 paragraphs. So completely this small text is all about this oral anticoagulant Remicor. So now could you tell me in the comment box what is your answer? Ningal answer on the comment here. Yes, Rensu, good evening. Hi, Regimol, good evening. Yes. Let me know your answer please in the comment box. Now we are going to do the method called elimination. നമ്മൾ elimination ആണ് ഇനി ചെയ്യാൻ പോകുന്നത്. So how we can do elimination method here? The word elimination, which means we are removing certain things or we are deleting certain things. നമ്മൾ ചില കാര്യങ്ങൾ അങ്ങോട്ട് എടുത്ത് മാറ്റുവാണ്. So what we can delete here? What we can remove here? Which options we can remove here? Yeah. So now tell me which options we can remove. Yeah. Because, see, if the question is asking what is the main feature, what is the main focus, what is the main or important one, that means other focus, other features, other important things will be there. But we should focus on what is the main thing, key feature. So what is the important feature here? So different options are here. Anyway, whatever it is, I need your answer. That's it. Okay, whether it is right or wrong, doesn't matter. Hi Shubhajit, good evening dear. Okay, LV, your answer is B. Okay, anyone with option? Yeah, Manju and Ashwati is saying it is option A. All right. Hi Dilu, good evening. Anyone with option C, guys? Okay, Beulah is also saying option A. A can remove, Swati. Okay, why Swati we are removing option A? Any guess? Can you tell me why we are removing option A? എന്തുകൊണ്ട് നമ്മൾ ഓപ്ഷൻ എ റിമൂവ് ചെയ്യുന്നു? What is the reason behind removing option A? It minimizes the risk of complications through targeted clot prevention. Okay, Swati is saying, Swati's answer is option B. All right. Hi Minu, good evening dear. Okay, Beulah. Okay, now your answer is B, right? Of course. Okay, Shubhajit, your answer is B. So I'll say my answer. Before that, I'll do elimination. It minimizes the risk of complications through targeted clot prevention. And somebody said answer is option B, option A. So can you tell me where is it mentioned? This is the key feature. This is not a feature. They're asking the key feature, important one. So something should be there which indicates this option A is important. So where is it mentioned? Key feature of this is like minimizes the risk of complications through targeted clot prevention. അങ്ങനെ ഇവിടെ പറയുന്നത്. Where is it mentioned? In the para. Hi Maria. Anu, yes. Hi Anu Maria. Yes, good evening. Yeah, very good Swati. That is the same reason because question is asking the key feature to you, not just a feature. ചുമ്മാ ഒരു റീസൺ അല്ല അവർ ചോദിക്കുന്നത്. What is the important thing? Key feature എന്താണെന്നാണ് ചോദിക്കുന്നത്. And we know if this is the manual, we need to know what is the speciality of that thing. So for example, here it is a medicine. ഇവിടെ ഒരു മെഡിസിൻ ആണ്. അപ്പോൾ മെഡിസിൻ്റെ സ്പെഷ്യാലിറ്റി എന്താ? ഒരുപാട് സ്പെഷ്യാലിറ്റി ഉണ്ടാവും. What is the main feature of the medicine? What is the important speciality of the medicine? That is the question. So here, option A is mentioned in the para. Mentioned alle because it is mentioned in the first line. Remicor is an oral anticoagulant primarily prescribed, അതായത് initially prescribed ചെയ്യുന്നു. This medicine is prescribed initially, firstly, to reduce the risk of serious complications arising from blood clots, including stroke and pulmonary embolism. But when you see or when you read this first line itself, very simply you can eliminate option A. Is it exactly the same? Of course not the same. Here it is mentioned minimizes the risk of complication. Here it is mentioned reduce the risk of serious complications. Not just complications, severe complications. Arising from. So here it is through targeted clot prevention. Only clot prevention is mentioned. But no, including stroke, pulmonary embolism. So simply we can eliminate this as contradictory to the question or opposite. What about option B? It provides effective treatment with reduced monitoring requirements. So what about it provides effective treatment? And the majority is saying your answer is option B. Hi Billa, good evening. Yeah, so why it is B? Why we can say or why we can select that answer as B? എന്തുകൊണ്ട് നമ്മൾ B ആണെന്ന് പറഞ്ഞ് സെലക്ട് ചെയ്യും? It provides effective treatment with reduced monitoring requirements. Very good. That is from a distinguishing feature. Very good, Shubhajit. Your answer is right. Okay, excellent. This is how you should locate your answer from the text. For example, when you get that right answer or wrong answer, whatever your answer is, you should have that idea, okay, I got this answer from this line. Because in part B and part C, our answer will be there. As you know, guys, reading is an open book exam. I can simply say that. Reading is an open book exam. Because question is there, answer is there. The only thing you have to do is find out the answer. That's it. നമ്മളൊന്നും ഇവിടെ ബൈ ഹാർട്ട് ചെയ്തിട്ട് പഠിച്ചെഴുതേണ്ട ഒന്നുമില്ല. നത്തിങ് ടു സ്റ്റഡി ഹിയർ. ഇറ്റ്സ് ഓൾ അബൌട്ട് യുവർ സ്കിൽ അസസ്മെൻറ്റ്. ഇഫ് യു ഹാവ് ദാറ്റ് സ്കിൽ ടു ഫൈൻഡ് ഔട്ട് ദി ആൻസർ, ദാറ്റ് മീൻസ് യു ആർ എ ഗുഡ് റീഡർ. Okay, so very good, Shubhajit. Very nice analysis. Okay, so here answer is actually from the first para, but not from the first line. It is actually in the second, third line. See, a distinguishing feature, that means the key feature, the important feature of Remicor. Exactly the question. So what is the distinguishing feature of this medicine? Is its simplified dosing regimen, which reduces the need for frequent monitoring commonly required with traditional anticoagulants. That means answer is option B. Simply that is the right answer. And when you get the right answer, you can bubble that letter. Our letter ningal bubble. Don't put a tick mark or anything, just bubble the letter. So it provides effective treatment with reduced monitoring requirements. That should be the right answer. That is the right answer. How can we eliminate option C then? It ensures better kidney health through regular function monitoring. Is it mentioned anywhere? It ensures better kidney health. Kidney is mentioned in the second para, second line. What is mentioned here? While fewer blood tests are needed compared to older anticoagulants, periodic kidney function monitoring remains important. I can simply say not mentioned. So answer is option B. B should be the right answer. Any doubts in the question? Yes, Regimol, sorry dear, it's not A. It's actually B. B aanu. We already eliminated that. Hi Sitara, Asha, good evening. Good evening. So this is all about part B, and I know majority of you have just joined. ഒരുപാട് പേര് ഇപ്പോൾ ജോയിൻ ചെയ്തിട്ടുണ്ട്. And definitely you please do watch the live after this one. Okay, ഇത് കഴിഞ്ഞിട്ട് നിങ്ങൾ ലൈവ് ഒന്നും കൂടെ കാണാം, so that you can just analyze how we are eliminating certain options, and this is a perfect example for your exam model material. Okay, so don't miss the session. And now let's move to the most important part, which is part A. And today we have a vagus nerve stimulation. That is a topic. Hello? Yes. Okay. So now let's move to this important part from part A, which is vagus nerve stimulation. And in this material, I think this is a very small text A, B, C and D, not a very large ones. So that I think I will explain this questions in detail today. I'll just show you how to skim and scan this particular part. Okay. And then let's decide what are the answers to the questions. All right. So here, already you guys know that we are applying skimming and scanning method in part A. And doesn't matter that quality of the material is important, but what should I say, for if this material is hard or tough or easy material, that doesn't matter. The method you're applying, that matters. But നമ്മൾ apply ചെയ്യുന്ന method ആണ് important, not the material. Okay, whether it is a simple material or a hard material, the method we are applying is the same. So what you should do, നിങ്ങളുടെ കയ്യിൽ എന്താണ് വേണ്ടത്, you have that skill, okay, to analyze the meaning of the words. And meaning is very important. I cannot say meaning is not important. ഞാൻ ഒരിക്കലും പറയില്ല മീനിങ്ങിന് വലിയ എന്താ പറയുക ഇമ്പോർട്ടൻസ് ഇല്ലയെന്ന്, ബിക്കോസ് മീനിങ് ഇസ് വെരി ഇമ്പോർട്ടൻറ്റ്. How much vocabulary you have, how much words, meanings you have, that means you can get a lot of correct answers. അപ്പം അതുകൊണ്ട് എത്ര വേർഡ്സ് നമ്മൾ കാണുന്നുണ്ടോ, if you're just reading daily, definitely you can see a lot of different words. So please do find out the meaning as well. So when you get a new material, definitely you can see the difference. Okay. So here Let's do skimming and scanning method, and of course there is a table mentioned here. One of the text will be a pictorial or something, definitely. Yeah, so let's see what is mentioned in vagus nerve stimulation. Okay, so do the material. If you guys haven't done the material, so please do the material, then we will discuss it. Hi Agila, good evening. Yeah, I'm good. How are you, dear? Yes. Okay. Yeah. Hi Anu, good evening. Good evening, Anu. Anyway, so I'll skim and scan, then we will decide what is the right answer. So vagus nerve stimulation, VNS, is a type of neuromodulation, which is a treatment that alters the activity of nerves. Vagus nerve stimulation involves implanting a device that sends regular, mild pulses of electrical energy to your brainstem through your vagus nerve in your neck. After reaching your brainstem, the electrical charge is discharged to different areas of your brain to change the way brain cells work. Vagus nerve stimulation works like a pacemaker of your heart. In fact, VNS is sometimes called a pacemaker of the brain. VNS is a treatment of option that you and your healthcare professional might consider after other traditional treatments have been successful. The use of VNS is limited to a select group of individuals who have treatment-resistant epilepsy or treatment-resistant depression. More recently, VNS has been approved as a rehabilitation aid for select people who have had stroke. So these are my keywords from text A. Okay. I will say, or I would say, this is not fast reading. If I watch fast reading, but this is not actually fast reading. Fast reading, which means whatever you're reading, the half of the thing will be in your mind. For example, I'll show you. Vagus nerve stimulation, neurodegeneration treatment, alters activity. So likewise, when you fast read something, that is called ultimate, you can say, the fast reading method. Okay. So fast reading, select that's not fast reading. So just to understand you guys, I'm just doing this. Otherwise, fast reading, which means majority of the words will be in your mind. Okay, rest of you can articulate. Anyway, text B. On the day of surgery, you will take an antibiotic to lower the risk of an incision-related infection. The vagus nerve stimulation device consists of vagus nerve stimulator or a pulse generator device and a wire lead or insulated wire with electrodes at the end of the wire. Your surgeon begins by making 2 incisions or cuts on the left side of your neck to expose your vagus nerve and the other on your upper left chest. The coil electrodes at the end of the lead wire were gently wrapped around your left vagus nerve through the incision made in your neck. Your surgeon then guides the insulated lead wire extending from the electrodes from your neck down to your chest. Then, because all the body parts are important, that's why. Yeah. Chest incision. Then they connect the end of the electrode to the battery. The battery is a little bigger than a silver dollar. It goes through the incision into your chest into pockets made over your muscle. So these are my keywords from B. And now we have a table, and table is very important, of course. Implications for VNS for anesthesiologists. Scenarios mentioned here, issues mentioned, management mentioned. Local issues during VNS activation, cardiac issues, respiratory issues, intraoperative issues during cardiac arrest, magnetic resonance imaging. I hope we have questions from cardiac arrest as well as MRI, because these 2 topics are very important. With or without general anesthesia. Anesthesia is important. Tingling or prickling sensation, hoarseness or sore throat. Yeah, a lot of symptoms mentioned bradycardias in COP or rarely cardiac arrest during intraoperative lead testing at implantation, altered voice dyspnea, and cough. Increased incidence of obstructive sleep apnea. Then when using laryngeal mask, airways potential obstruction due to laryngeal musculature contraction, use of diathermy, and therapeutic ultrasound, external defibrillation, and electrical cardioversion may damage the generator. Risk of excessive heating of the leads and damage to the stimulator. Then spurious device stimulation and disruption of VNS system. Then what about management? Resolve the reduction in current intensity, not critical, may lessen or over time. Check the lead replacements and connections may need to terminate the procedure. Lower stimulation frequencies, longer period of time. And device inactivation can improve the issues. Vigilance of new onset sleep apneic symptoms. May require VNS to switch off to reduce the risk of airway obstruction. Short wave diathermy, microwave diathermy, and therapeutic US diathermy should not be used. Then use lowest amount of appropriate energy fibrillation pads to be placed far from the generator and implanted lead. Pad should be placed so that current travels In a vector perpendicular to the VNS, discuss the radiology team looking at the field strength of MRI scan, type of transmit coil, amount of radio frequency, energy, and anatomical site of scanning. Keep the exclusions on from the C7L3 vertebrae. Device to be switched off and reprogrammed after scanning. Then text D. Most patients will be discharged the same day. Keep the wound clean and dry. Stitches are self-absorbing and do not need to be removed. Maybe you can expect this question. It is okay to wash the incision with soap and water after 3 days. Watch for redness, swelling, drainage, incision sites. More detailed instructions will be given before discharge from the hospital. There will be a wound check appointment for your child with the neurosurgery in 2 weeks. Neurosurgery follow-up patients may be scheduled for up to 5 appointments for follow-up in the neurology clinic. These appointments are about 2 weeks apart. The appointments are scheduled in order to gradually increase VNS setting to therapeutic range. How often the appointments occur will be decided by the neurologist. That's all about keywords. Okay, so I think I barely took 1.5 minutes. I think so. Anyway, so now we are just moving to the question sessions. Okay, so let me know in the comment box and please do comment your answers here. So whatever you're doing, do with 100% dedication. Okay, so don't do anything for your, for others. Yeah. So I'm going to read the first one. Why shouldn't we need to bother about the discarding of stitches? Even without reading, I know the answer. Do you guys know the answer? Not without reading, without even rechecking, I know the answer. Shouldn't bother stitches. Or you can underline shouldn't discard stitches. Yeah, let me know your answers. Very small text, so it is very easy to find out the answer. So this is how you should start. Yes. So where is it mentioned? Discarding of stitches. You don't have to bother about discarding, avoiding of the stitches. Every other mention. Very good, Ganga. Your answer is absolutely right. Answer is D. Okay, it's a very small text. Find out your answer. Every very good, Minu. Answer is D. That is from text D. In text D, very directly they've mentioned in the first para, not first para actually, second para I can say. Keep the wound clean and dry. Stitches are self-absorbing and do not need to be removed. Yeah, it's very clearly mentioned there. So, answer is D. Yes. Good evening, dear. Yes, LV, answer is D. Yes, Anu, Atira, it's from D. So, I think how many of you got the right answer? Yes, Atira, Anu, LV, Minu, Ganga. 5, right? Only 5. Why? So pathetic. Very good, Sitara. Your answer is right, which is from D. Second question. When would the need of ending of the procedure comes into action? So, my keywords, when, ending, procedure. So, where they've mentioned about the ending of the procedure. When would the need of the ending of the procedure comes into action? A very small text, guys. So, it's very simple. You can just find out the answer very quickly because it's such a small material. Yes. When would the need of ending of the procedure comes into action? Okay, is it D? Yes, Joe and Dilu. First question is from D, I agree. What about second question, guys? Yes, Beulah. First one is D. Yes, LV. Very right answer. Okay, answer is from C. Second question answer is C. Where is it mentioned? Can you tell me? In text is C, where they've mentioned about when would the need of ending the procedure comes into action. So here, the first thing they have mentioned is all about local issue versus VNS action. Cardiac issues mentioned, respiratory issues mentioned, intraoperative issues mentioned, during cardiac arrest is mentioned, magnetic resonance imaging or without general anesthesia is mentioned. So where they've mentioned about this thing. The levedayana, which point indicating or which management indicating this is comes to the final step. Very good. It's cardiac arrest. Okay, so external defibrillation and electrical cardioversion may be damaged. Use lowest amount of appropriate energy. Then pads should be placed so that the current travels in vector perpendicular to the VNS. So That might be the answer. As well as here also, check the lead placement and connections may need to terminate the procedure. See? Okay, so answer is in C. Third one. Who is in charge of setting up appointment with the patients following the procedure? So who, then appointment, and I think charge. Because procedure we are talking about this one, so that doesn't matter. I mean, it's not an important word for me. So who, charge, appointment. Yes, Sitara, very good dear. It's from C. So what about third question, guys? Sorry, I know, Adira, it's not B. Not Minu, it's not B. Yes, Visma, it's not B, dear. It's actually in D. Okay, sorry, C. Third one is from D. Very good. Yes, Ganga. Again, you scored. Okay, so Ganga, you know what is the right answer. So if you're reading much more better, definitely you can score 20 out of 20 in Part A. And others also, please do some hard work plus smart work. Okay. Yes, Dilu, Rinzu, it is D. Very good, very good. That is mentioned in D. Who is in charge of setting up appointment with? So, very direct answer from text D. Appointments will be done with the help of. It's all about the neurosurgery. So, you can consult a surgeon. Yeah, so neurologist. That is from, yes, D. Then, which are the common conditions to be treated with vagus nerve stimulation? So, my keywords. Common conditions and treated. So which are the common conditions? Some set of conditions that we can be, it can be treatable with this procedure. Where is it mentioned? This condition can be treatable with the with this particular procedure. Yes, I don't know how to pronounce your name. I'm so sorry. I'm very bad with pronouncing names. Anyway, Mathig, right? Your name. Anyway, nice name. Yes, Bila, Binu, Sitara, Anu, Vismaya. That is D. Very good, very good. Fourth one answer is A. Again, Ganga scored. Very good, Ganga. Okay. Answer is mentioned in text A. A set of problems mentioned here in text A. Because of these issues, you can go for the treatment. Okay. So, which treatment that alters activity of nerves, vagus nerve stimulation involves implanting a device that sends regular, mild impulses of. So, that is all about what is this procedure in the first para. The question they are asking why we are going for this procedure. So, yeah, that is in the last paragraph. It is directly mentioned. So, answer is A. Fifth one, which are the important parts of vagus nerve stimulation device? So, important parts device. So, where they've mentioned about some set of important parts of the device. So, that is here in text B. So, my answer is B. Okay. Edake different parts of the very simple question. The vagus nerve stimulation device consists of pulse generator dash and dash and dash. So, answer is B. Yes, Ganga. Very good dear. Yes, Sitara, Vismaya, Anu, Minu, Mohan. Yes. Answer was text is A. I mean, fourth one is A. Fifth one is B. Then, sixth one. How does the function of VNS usually described? So, function usually described. Engine describe usually. Function is describing, which means simply the question is what is VNS? Ale. So, do you want to really read that one? Recheck and avashundo? I don't think so. So, answer is A. Ale. Yes. Seventh one. What are the different phases of vagus nerve stimulation surgery? So, phases, which means stages. So, different stages, different phases of the surgery. Edake and different stages of the surgery. Any different stages mentioned of the surgery? So, here your surgeon begins by making 2 incisions. That is the first step. Pin on the left side of your neck to expose your vagus nerve. So, step by step procedure of the phases of the surgery mentioned in text B. So, I can say answer is B. So, this is a variety combination of answers. So, first one is D, second one C, third one D, fourth one A, then B, A, B. That is the pattern. Answer keys. Alright. Yes, Anu, LV, Vismaya, Sithara, Ganga. Yeah. Very good, very good. Yes, Ganga. Okay. So, now let's move to short answer questions, which is from 8 to 14. So, the first question. Installing of which equipment should be done distantly from the generator and implanted lead to resolve the issues raised during the cardiac arrest? This is a little bit lengthy question. But even though a little bit lengthy, it's a very, simple question. So, installing equipment and cardiac arrest. Where is it mentioned? Because cardiac arrest is a word we know, you know, it's only mentioned in C. Where എവിടെയെങ്കിലും നമ്മൾ cardiac arrest കണ്ടോ? I don't think so. I don't remember. In text, nothing mentioned about cardiac arrest. Yeah, it's mentioned about, right? Pacemaker mentioned, yes. But cardiac arrest, that word is not mentioned. Brainstem is mentioned. In text B, nothing mentioned about cardiac arrest, I'm sure. Yeah, in text C, we have cardiac problems as well as cardiac arrest mentioned. Cardiac issues mentioned, Anna, but cardiac arrest is mentioned again in text C. And what is another keyword? Equipment. So installing equipment, cardiac arrest, right? Yeah. Excellent, Ganga. Answer is right. That is fibrillation pads from text C. When you write the answer, always and the careful with the spelling, okay? Because fibrillation have F-I-B-R-I-L-L-A-T-I-O-N. Fibrillation, double L is there. Not a single L, double L. So fibrillation pads to be placed far from the generator. That is mentioned there. And implanted ahead. So it is cardiac arrest in the samayathalle. So that is fibrillation pads. That is the right answer. Okay. Yes, very good. Yes, that is the right answer. And ninth one, how many days should be surpassed prior to cleaning the wound with soap and water after the surgery? So how many? Etra divasam. If the question is asking regarding how many and how much, you just write the number there. Okay, don't write nothing more, just need the number. So how many days mentioned? Surpassed, and soap and water. So I think I will underline cleaning. Yes, it's not fibrillation pad. I think it is fibrillation pads. Like plural, so please be careful. Yes, Billa. Yes, Saumya, LV, Minu, Anu, Matthew. Yes, yes. Yeah. So what about ninth one? Days already mentioned in the question. So just write 3. 3 is the answer. Okay. 3 ആണ് കേട്ടോ. Don't write 3 days. ഇവിടെയാണ് ആൻസർ വരുന്നത്. In text D, the second line. It is okay to wash the incision with soap and water after which means prior. 3 days. How many days? 3. So answer is 3. 10th one, the size of which component seems to be a touch larger than a silver dollar? Again, silver dollar, I've seen this word in text B, I think. Okay, text B, because I've noted that word, silver dollar. And silver dollar is connected to size larger silver dollar. So I think it's in text B, somewhere here. Not in text B. I've seen such a word here. Somewhere here. Your surgeon then guides. They then connect the end of the electrode to a battery. Yeah, very good. The battery. The battery is a little bigger. That means larger than a silver dollar. So that means answer is little. No, battery. Battery is the right answer. Article is mentioned there. So when you write the answer, do just write the battery. Okay, that should be the right answer. Next one. 11th one, which property of the sutures expel from being removed after the procedures? Property, sutures, removed. Procedure കഴിഞ്ഞിട്ട് what we are removing there? I mean, what type of sutures or stitches we are removing? From my memory, I will say self-absorbing. What about you guys? What is your answer? Can you tell me with your memory? Let me check. Do you have a better memory like me? Yes, the battery. Yes, Matik, Minu, Hatira. Dilu, it's not just battery, the battery. Because article is important. Yes, Anu, Matthew, Vismaya, the battery. Oh, very good. My answer is right? Yeah, self-absorbing. So when you write self-absorbing, can we write like this? Can we write so? No, this is wrong. Why? Because in the paragraph there is a hyphen mentioned. So hyphens are very important. So when you write the answer, do write self-absorbing. That should be the right answer. And it should be like self-absorbing. Okay. Yep. Yes. And that is mentioned here in text B, I guess. No, text B, text C. D. Keep the wound clean and dry. And stitches are self-absorbing and do not need to be removed. So that means self-absorbing. And next one, the device that gets damaged during the cardiac arrest due to other issues. So device damaged, other issues. A device that gets damaged during cardiac arrest due to other issues. So device damaged, other issues. Either device or which device is getting damaged. And this is a little bit confusing. Very direct answer, but still not that much easy to find out. Because we know table is very important. Minute words are very important. So answer is from C. C is mentioned. Can you find out where is it mentioned? This one, this device. Which device? Very good, Ganga. Generator. Okay, so answer is generator. And here it is mentioned in the cardiac arrest session, external defibrillation and electrical cardioversion may be damage the generator. So here again, same answer, the generator. Okay, so when you write the answer is generator, but already article is mentioned there. So when you write the answer is the generator. That will be the right answer. 13. What recognition has been bestowed? Okay, the generator. Is LV, Minu. Is Anu. Okay, Bila. The generator. 13th one. What recognition has been bestowed upon VNS in the management of stroke of late? So my keywords: recognition, VNS, I'm not underlining, bestowed upon, management. Yeah. So what about 13th one? I have no idea. Seriously, I have no idea about this answer. So you guys have to tell me. What is the right answer for 13th one? Recognition, bestowed upon, management. What is the meaning of that? I'll just give you a clue. Yeah, Ganga, your answer is right, but something is missing. And that again, answer is in text A. Very good. That is right. Answer is mentioned in A. Where is it mentioned? Yeah, only rehabilitation. Are you sure? So here, more recently, VNS has been approved as a rehabilitation aid for select people who have had a stroke. Up answer in that again. Very good, Dilu. Your answer is right. Answer is rehabilitation aid. That should be the right answer. Because all other keywords are mentioned here very directly. So that answer should be rehabilitation aid. That is the right answer. Okay. That's the right answer. Rehabilitation aid. Then 14th one, what must be consumed prior to VNS to avert the risk of cut infection? Avert to control, reduce here. So consumed prior. So consumed prior, avert. And then we consume consume, which means something you can eat. I think it's a medicine. Yeah. Yes, Vismaya. Yes, Ganga, Anu, Dillu, Minu. Yeah, rehabilitation aid is the right answer. What about 14th one, the last question? 14th question. A very simple answer, and that answer is, I think, mentioned in text B, the step-by-step procedure. And where is the answer mentioned? Yeah, that is antibiotic you can take. On the day of surgery, you will take an antibiotic. Same here, an antibiotic. That should be the answer. If the question is plural, of course, you can write antibiotics. Okay, so otherwise write an antibiotic. Endana question? What must be consumed? Endu kazhikkanamne ullu. So nothing they are asking about a singular or plural thing. So that you can write an antibiotic. An antibiotic. That should be the answer. Very good. Yes. Yes, LV, Anu, an antibiotic. Okay. Yes, Dilu. Very good. Right answer. Yes, Agila, your answer is right, dear. An antibiotic. Yes, Minu, very good. Okay. Then coming to the last set of question, which is fill in the blanks. 15. Among the two incisions made by the surgeon on the left side, one is made on the neck and other is on the dash. What is the missing word here? Two incisions, then left side, neck. Where is it mentioned? That means it is step by step procedure alle. So answer will be in text B. I think so. I think it's from here. Your surgeon begins by making two incisions, keyword. One on the left side is already there, of your neck to expose your vagus nerve, and the other on your upper left chest. So answer is upper left chest. I would suggest you to write upper chest. Why? You can write upper chest. Why? Endonda. Your answer is right. I agree with your answer. Answer is upper left chest. Pakshe, left is already there in the question. So that you don't have to repeat the same. Anganeyanu OET oru instruction. So you don't have to repeat the same exact word from the question into the answer. So that you can write upper chest. Or your answer is true. Okay, upper left chest. Something specific. So that it is right. Otherwise, you don't have to repeat it. Okay, I don't think you'll repeat it. Upper chest is the right answer. 16th one, the dash such as escalated obstructive sleep apnea can be managed by lower stimulation frequencies and long time device inactivation. I am very damn sure that this answer will be from C. From the table. Escalated, that means elevated, increased. Sleep apnea, obstructive sleep apnea. Long time device inactivation. So inactivation. Yeah. So what is the right answer? The dash such as obstructive sleep apnea. I think from here. Yeah. That is respiratory issues. The dash, so that means it is related here. So answer is respiratory issues, lower stimulation frequency, longer period of time, device inactivation. So exact answer ana, that is respiratory issues. 17, being a kind of dash, vagus nerve stimulation is a treatment that modifies the action of nerves through the vagus nerve. So treatment modifies and vagus nerve. Yeah, right answer Anu. Yes, LV. Dilu, yes. Very good, Vismaya. Yes, Minu, respiratory issues. Okay. 17th one in there again. What about 17th question? Being a kind of dash, then vagus nerve is there, treatment is there, modifies is there. I think answer is from text D, right? Yeah, of course. So that answer is mentioned here in text D. I think from the last para, yes. Neuromodulation. No, that will be the right answer. Where is it mentioned, neuromodulation? Is it in text D or in some other text? I'm not sure. Text D ano? Or text A? Or text B? Or text C? I don't think that in text B. Text B ano? Or text C? Or text A? Answer is right, which is neuromodulation. Answer is from text A, the first line. Okay. VNS is a type of neuromodulation, which is a treatment that alters the activity of nerves. What nerves? Vagus nerve. Okay. So answer is neuromodulation. That is the right answer. 18th one, the dash are gently wrapped around the left vagus nerve through the incision made in the neck. So left vagus and the neck. What is that one? I think some kind of coil or something, right? Because I've seen that word somewhere. I remember that thing. Somewhere here. Your surgeon begins vagus nerve and the coil electrodes. Yeah, I think this is the answer. Coil electrodes at the end of the lead wire are gently wrapped around your left vagus nerve. Yeah, my answer is correct. So answer is coil electrodes. Yeah, very good, Ganga. Right answer. Coil electrodes. 19. Dash is conducted with or without anesthesia, leading to the risk of overheating. Overheating what? The leads and damaging the stimulator. So my keywords: anesthesia, overheating, stimulator. Again, seeing this word anesthesia, overheating in text D, sorry, C. Yeah. Here, general anesthesia. Okay. Can you tell me the answer? I think answer is from here. Is it MRI? Because MRI is not mentioned anywhere. I mean, the abbreviation is not mentioned anywhere. So don't write MRI. That is wrong. Answer is magnetic resonance imaging. You should write so. Because I know you know that MRI, which means magnetic resonance imaging. But this abbreviation is not mentioned anywhere, right? Is it mentioned anywhere? If it is mentioned, of course you can write. Magnetic resonance imaging discussed. Okay, MRI scan is mentioned here, so that you can write MRI. Okay, sorry. Abbreviation already mentioned, Anna, so that you can write MRI. Okay, right, Anna. Yes. Either you can write MRI or you can write magnetic resonance imaging. If it is not mentioned, don't write the abbreviation. Okay. Then 20. Once reaching the dash, electrical charge is discharged to other areas of the brain to alter functioning of the brain cells. So, electrical, then alter brain cells. Magnetic resonance imaging. Very good, very good. Yes. And I think this is the last question is from text A. Where is it mentioned in text A? What was the question? Yeah, brain cells mentioned in text A. Somewhere here. After reaching your brain stem, the electrical charges, keyword from the question, discharged to different areas of your brain to change the way brain cells work. So I think answer is brain stem. I know. Yeah. So that is the right answer. So answer is brain stem. Don't write brain stem. It is brain stem. It is a single word. Okay. Don't just separate the word. So answer is brain stem. So that's all about today. Anyone with 20 out of 20? Anyone with 20 out of 20? Undo. 20 out of 20 today? The same question I'm asking every day. How many of you get 20 out of 20? ഇത്ര പേർക്ക് 20 out of 20 കിട്ടുന്നു അല്ലെങ്കിൽ കിട്ടി? Yeah. No one. Yeah, that's fine. Okay. Some days we will get 20, some days we will get 19. Whatever it is, do practice every day. Okay. So it will be easy for you. So that's all about today. See you on Wednesday. Take care. Thank you. Bye.